But today we are fortunate to have with us Bryan Gay before Medicare open enrollment begins on October 15th to help guide us through many complicated Medicare options. Bryan is the owner of Boomer Insurance Group, which is a boutique agency specializing in expert Medicare insurance advice. And for 23 years, Bryan has assisted clients to easily understand complex insurance topics. He often speaks at hospitals, seminars, Medicare education events, and financial planning seminars. And he is on several leadership councils for the industry's largest Medicare insurance companies, influencing the benefits of Medicare insurance plans. If you have any questions for Bryan throughout the program, please feel free to submit them. I'm sure you guys all know how Zoom works, but at the bottom of the screen, there's chat and then there's Q&A. So you can type in those questions and I can feed them to Bryan. And of course, we're going to have time at the end for any questions that you have. And so now I'm going to hand it over to Bryan to kick us off.
Perfect. Thanks so much, Savant. So thanks for the introduction. I'm still not the greatest with technology. So if you see me kind of sputtering and doing things with technology, it's because I'm really good at Medicare, not really good with technology. But on the question and answer stuff that you mentioned earlier, yes, anybody who has a question, I would highly recommend you just click that little Q&A button, type in either the chat or the Q&A, and then John, if you just want to just raise a hand or pipe in or just break in while I'm talking, then I'd be happy to answer the questions right then and there.
Okay.
Or just answer it towards the end, because I will have a question and answer just open for everything at the end too. No. All right. So then I'll tell you a little bit more about my background, about the company, and kind of what we are going to cover tonight. A little bit about my background is I'm originally from Oklahoma. So if you hear a bunch of poor grammar, it's because I'm from Oklahoma originally. And then the bad news for you guys is I was raised by a school teacher. So I say that because I ask everybody to take notes, especially if you can get at least 2 blank sheets of paper. So if you have a pen and paper, it'd be best to have 2 totally separate sheets of paper. And everything that will eventually come up on the board at these little PowerPoint presentations, I'd like you to have 1 piece of paper for option number 1 and 1 piece of paper for option number 2. And that way you can kind of see them side by side. And it makes a lot more sense when you go back and look at the notes from this meeting later. It will be recorded, so you can always reach out and get the copy of the recording. And then it usually takes a few days to get that kind of up and going. But then the company is Boomer Insurance Group. So with us, what we deal with is finding people the right Medicare plans. So we are licensed in many states. There's some states that we're not licensed in, but pretty much anywhere from Maryland all the way down to Florida, we can help people. So if it's North Carolina, South Carolina, Georgia, Florida, Virginia, a lot of our clients are obviously in Virginia because that's where we are headquartered. And what we're going to talk about today is what is publicly available to everybody. So here's what we're not going to talk about today. We are not going to talk about some plans that are offered for special groups of people. Like there's some people who work for the federal government, and the people who've worked for the federal government, they're allowed to have something called the FEHB, the Federal Employees Health Benefit Plans. The rest of us cannot have those plans, so we're not going to talk about those plans. If you are a federal retiree and you want some information about it, you can ask us any questions because we know all about the federal programs also. There are some people who retired from 20 plus years in the military. Those people get something called TRICARE for Life. So we're not going to talk about military health coverage, which is called TRICARE for Life. I grew up on TRICARE for Life. So if anybody has questions about TRICARE, I'd be more than happy to explain that too at some point. And then some companies just offer group retiree health plans. Like some people might have retired from DuPont or Ford Motor Company or Microsoft. So if people have questions about a retiree group plan, please call us. We'll happily talk with you about it and figure out if it's right to stay on there or not. But today we're only going to talk about the 2 options that are available, and they're available across the whole nation. So it's not just one county specific or one state specific. This is just an overview of the total Medicare program. So with that, I'm going to kind of get in, and then I'm going to try to share my screen, which is always fun and exciting. I got to click this button here, and then I click this button here, and I'm going to try to get this little presentation to pop up on the screen. I think I do this button. And we did try this a second ago. It goes dark for a second, then it pops back up here. So Siobhan, you can see that, right?
Yep, everything looks great.
Wonderful. Okay. So there's some contact information. And then you can always just reach out, via phone or via email kind of thing. But getting into Medicare is one of those kind of confusing things because most people are told you have to sign up for Medicare at age 65. Guys, that is not always accurate. So I give that old statement, you heard that statement, darned if you do and darned if you don't. Well, that's Medicare in a nutshell. Because you're darned if you do sign up for Medicare when you should have not signed up for Medicare at age 65. So guys, there's a lot of people who should absolutely not be signing up for Medicare at age 65. And if they do sign up when they should have not signed up, they get penalized for signing up when they should not have. But you're also darned if you don't. If you don't sign up at age 65 and you were supposed to sign up at age 65, then yes, you can also be penalized for not signing up when you should have signed up for Medicare. So it's all dependent on a lot of different factors. And it's different for different people who even work at the same company. So if you need to find out whether you should be or should not be signing up for Medicare around that 65th birth month, just call us. We can answer that kind of question for your certain particular needs in 5 minutes. It's very simple. So, but that's just signing up for Medicare gets a little complicated. And then when you finally do get signed up, then you're presented with all these choices. And I would say people get confused with Medicare for a number of different reasons. But one of the reasons they get confused, they're just not used to having this many choices, because like the majority of us, we go to work at a company and we do our job. And while we're doing our job, once or twice a year, the human resource people come in and say, it's open enrollment at the job. Here's your 2 or 3 choices. You pick the 2 or 3 choices, and that's your health insurance for the next year. It's kind of like the high, the medium, and the low. Health insurance through the job. So people don't have that many choices, so it's easier for them just to kind of pick one and move on. When it comes into Medicare choices, there is no shortage of insurance companies and plans they offer. People start getting all this mail. So they get these mailers, they get these weird phone calls. If you live in certain areas, you might get weird people knocking on your doors on Saturdays and Sundays telling you they're here to help you with your Medicare insurance. It's really odd. You also have friends and family telling you what they did. And they usually tell people about half the information that was needed for them to make a choice. These insurance companies offer both options too. So like I mentioned earlier, we're going to cover both of these options. We're not going to talk about specific insurance companies though tonight, because Humana offers option 1 and Humana offers option 2. United Healthcare offers option 2 and United Healthcare offers option number 1. And Cigna does the same thing, and Aetna does the same thing. And Blue Cross and Blue Shield offers option 1, and Blue Cross and Blue Shield offers option 2. It's not as important the company that you choose, is really which option you choose is going to dictate really how your coverage will work. So with that, we're going to jump into option number 1. So from here on out, if you get that blank piece of paper, at the top of that blank piece of paper, if you put the words option number 1 at the top. Now, I did say I'm from Oklahoma. originally. So we have analogies where I grew up for pretty much everything. So I always tell people option number one is kind of like having your own car. So if you write the word car in quotation marks, well, that's kind of weird because we're talking about Medicare insurance. And now we're talking about cars. Who knows how this works? Option one, I tell people it's like a car because everybody knows how a car works. Nobody buys a car to save money. We buy a car because we want to go where we want to go, when we want to go, for whatever we wanted to go there for. So this is how option number one works. It's designed for freedom. It's designed for flexibility. It's designed to be easy and really great coverage. It just would cost people more money over their retirement to choose option number one as opposed to option number two. So with that analogy, let's talk about how it really works, the logistics. So if you choose option one, you wind up with 3 ID cards. So you're going to have to carry all 3 ID cards with you. All right. Well, the first ID card is going to be the Medicare card. And the Medicare card is going to have Part A and Part B listed on it. Now, both of these parts, A and B, are through the federal government. So you don't get an Anthem Part B or a Humana Part B. It's just Medicare Part A and Part B. These 2 parts are separate insurances. Part A, they call it hospitalization insurance. If I were naming things, I would name it inpatient insurance because it covers medical bills that are covered underneath inpatient medical services. Yes, like the hospital, but also an inpatient rehab. Those bills are filed under Part A insurance. And hospice, if anybody's ever known anybody who's had to go onto hospice, hospice services are filed and paid for under Part A insurance. So it's not just the hospital. Well, now, just like any insurance, we have to pay for insurance. Well, you have been prepaying for Part A your whole entire life. Every single one of your paychecks, if you ever looked at a pay stub, it says the federal tax and then the state tax and then the FICA tax, which is Social Security. And then there's this little line item on the pay stub that says Medicare. So Medicare Part A is a payroll tax that you've been paying your whole life. And then when you go to finally start using Medicare Part A and you've retired, you no longer have to pay for Part A. It's considered paid up. And all you have to have is 10 years of work. They call it 40 quarters, but 40 quarters is 10 years. So as long as you've worked for 10 years or your spouse has worked for 10 years, then you would not have to pay for Part A when you turn 65 because you prepaid for it. But then there's Part B. We have not prepaid for Part B. Now, Part B currently is $174.70 every month. So if you notice on your screen, that's just what popped up there. So $174.70 is the 2024 Medicare Part B monthly payment. The government changes this from year to year. They don't typically release that data until the middle to later part of October. And sometimes they release that after an election. So who knows when we'll find out what 2025 monthly payment is for Medicare Part B. Now, Part B, what it covers is outpatient medical bills. So most people say the doctor's office. Yes, it's going to cover the bills at the doctor's offices, but it's going to cover specialists. It's going to cover emergency rooms. It's going to cover ambulance rides. It's going to do outpatient surgeries like cataract surgery or carpal tunnel surgeries. Most services are actually billed under Part B because most services these days are outpatient procedures, you know. So everybody has to pay for Part B when they start Part B. But some people have to pay more for Part B because of their income. So if you guys notice where it just popped up on the screen, this IRMAA Part B additional monthly payment. Well, what is IRMA? Kind of sounds like a lady's name. Well, IRMA is the income related monthly adjusted amount. Income related monthly adjusted amount. It's dealing with the government. It's easier to read it backwards. It's the amount adjusted monthly based on your income. So if somebody's a higher income earner for 2024, if you're a single income filer on your taxes, if you've been making more than $103,000, well, then you're going to have to pay more for Medicare Part B. If you're a joint filing, husband and wife, spouses, at a joint filing, if you guys make $206,000 or over, then again, you're going to be paying more for Medicare Part B. We call that the extortion. So if somebody gets an extortion letter, they usually think, why am I getting this letter and why do I have to pay more for Part B? It's actually based on the tax return you filed 2 years ago. Well, here we are in 2024. So the government's going to be looking at your 2022 tax return. Well, pretty soon, before we know it, it's going to be 2025. And your Medicare rates in 2025 could be increased by the tax return you filed in 2023. So you can see where it's just a constantly moving 2-year increment. The year in the middle never matters. But people are caught off guard quite a bit of times about that. We do help our customers try to get out of that income related adjustment. But that's a whole discussion by itself for sure. But just know that for higher income earners, even in retirement, they still have to pay more for Part B. All right. So we prepaid for Part A. Now we've paid per month for Part B. Well, how does Medicare work? Like, how would this actual ID card work when I would go to the doctors or go to the hospitals or go to my specialists? Well, this is how it works. I'll have you jot this down. It says Medicare pays 80% after I pay my Medicare medical annual deductible of $240. It's pretty low deductible, in my opinion. Most people's deductibles these days have a comma involved in them. But it's based on a calendar year. So for instance, today I've been enrolling a lot of clients today that start tomorrow for October, and some of their plans need to start for November. But if they go with option 1, they're going to have to pay the first $240 of their medical expenses, doctors and blood work. And after they pay the $240 deductible, Medicare starts paying 80% of the bills the rest of the year. It starts again in January. And the government sets the deductible. So if the government moves it to $280 next year, well, then you'd have to obviously cover the first $280 of your medical bills. But after that deductible, Medicare pays 80%, which is kind of the majority, but it leaves us with this leftover 20%. And the real problem with the leftover 20% is it's unlimited. So guys, 20% of a doctor visit doesn't cost that much. But 20% of an outpatient surgery is a lot of money. 20% of ambulance rides, emergency room visits, 20% can add up to tens of thousands of dollars. I mean, sometimes hundreds of thousands, not often. But this is why we get a Medicare supplement plan. Now, a Medicare supplement plan is done by insurance companies. So you get a Cigna Medicare supplement plan, or Humana Medicare supplement plan, or United Healthcare AARP Medicare supplement plan. Now, they're technically called Medicare supplements, but to confuse people, they've named everything twice. So if you see in the Medicare supplement ID card now, see where it says the word Medigap? Medigap is the nickname for Medicare supplements, like tomato and tomato, still a red tomato. So these supplement plans, around a monthly price, there's people trying to figure this out for pricing and budgeting. In most of the areas in most of America, a 65-year-old person would cost around $130 a month. So, guys, if you're in Florida, don't call and tell me it's $230. I know it's more in Florida. I know it's more in New York, and I know it's more in a lot of some other little certain states. But in Maryland, DC, Virginia, North and South Carolina, Georgia, most of these states, for a 65-year-old person, it's going to be around $130 a month. These prices will go up a little bit every year as people get older. I've just enrolled somebody because she just moved to Virginia from Ohio, and she's 88 years old. And this was earlier today. She's going to pay $198 for her Medicare supplement plan. So it does go up a little bit every year. But now that we've paid this monthly payment for this insurance, well, how does it work? It works like this. These supplement plans will pay all the remaining 20%. So I'll say that again. The supplement plan pays all the remaining 20%. Well, even from being in Oklahoma, my math isn't that good, but if you add 20% plus 80%, that's 100% covered. So at the end of the day, if you guys have any older friends or family members, if they say things like, well, I can go to any doctor I want to go to and I don't have to pay for nothing. I just had a knee replacement, didn't pay a penny. Please don't let them tell you that. They paid at least $174 a month to Medicare. Then they paid at least $130 a month for a supplement plan. They already met their deductible that they forgot about. And yes, okay, the rest of the calendar year, they're not paying for a doctor visit. They're not paying for physical therapy. They're not paying for an ambulance because they're 100% covered. But again, they are paying something. They're just paying monthly. And Medicare doesn't cover drugs. So when I actually started helping people with Medicare insurance, Medicare didn't even have a prescription drug program. This didn't come out until 2006. It's been a while. So now Medicare has this program called Part D. The letter D stands for drugs. Okay. Now it's a government program, but it's administered by insurance companies. So you don't just get a Medicare Part D drug plan. You get a Cigna Part D drug plan, or an Anthem Part D drug plan, or Mutual of Omaha Part D drug plan. They're all done by insurance companies. In most of the states, there's between 18 and 21 plans available. Like here in Virginia, there's 20 plans. In North Carolina, there's 20 plans. In South Carolina, there's 21 plans. In Florida, there's 19 plans. So there's a lot of options to choose from. We do all the plans, so we just look at which prescriptions people use, the pharmacy they go to, and figure out which one of those plans is kind of the right one for that person. But we're still going to be paying for it every month. So as an average, it's usually around $30 a month for a Part D drug plan. Again, that's an average price. So you would pay maybe $30 to Humana, or $30 to United Healthcare, or $30 to Cigna. That covers your insurance. Well, if you're a higher income earner, remember your friend Irma from earlier? Well, the government is going to come back and try to charge you more money if you're a high income earner. So while you might pay Humana $30 or United Healthcare $30 for your drug plan, you'd have to pay the government an additional $12 or $53. And if you make a very large amount of money, you might have to pay the government $81 more every month just to have drug coverage. It's kind of ridiculous, but I won't get into how ridiculous that is. But just know that if you're a high income earner, then the government's going to try to steal more money as usual from people who make high money. So that would be paying for the drug plan. Now, how does it work? Well, you get an ID card. You take that ID card down to the pharmacy. It works like any other health insurance you've ever had, because there's going to be some kind of copayment for prescriptions. And the copay for prescription is going to vary depending on the drug tier and the pharmacy I go to. So let you guys jot that down real quick. It's a pretty big sentence. But there's copays for prescriptions that vary depending on the drug tier and the pharmacy I go to. The higher the tier, the higher the copayment. So if people take these low-cost generic prescriptions like amlodipine or metoprolol or levothyroxine or simvastatin or atorvastatin, meloxicam, the normal ones that most of people can't pronounce or spell, if you can't say it and you can't spell it, it's probably a generic, which means it's a pretty low-cost tiered drug. So your copayment's pretty low. But if you can start saying it and spelling it, it might start being a name brand drug like Restasis for eye drops, or Xarelto or Eliquis or Ozempic. Oh gosh, that's a big one now. Ozempic. Those are really expensive prescriptions. So the copayment is a lot more expensive. So kind of typical. If it costs more, your copay would be higher. So in a quick review of option number one, I say it's kind of like a car, because you can go to any doctor in America and they just have to bill Medicare. So there's not really a network of doctors. Remember, you're driving where you want to go, you have a car. So you can go to any doctor in America that just bills Medicare, which most doctors bill Medicare, just so you know. When you do go to those doctors, after you met that first $240 deductible, rest of the year, you're not going to pay anything for doctors or hospitals or surgeries and things. But you'll still pay copays for drugs all year long. And you got to carry these 3 ID cards with you. So that's how option number one works. You have your Medicare card, a supplement card, and a drug plan ID card. All right. Now, hopefully everybody was able to jot down those little pieces of information. We're going to jump over to option number two. And again, guys, any questions or any comments, if you just put them in the question and answer, then I can answer them now or in just a moment when we do the question and answer session. But with option two, this option was actually designed to save money. So in most cases, this program does save people money, which its primary purpose was saving money and is saving money. But it's not like a car. It's a whole lot more like the bus. So I'll have you write the word bus on your separate sheet of paper on your next paper for option two. If you think about it, it's so similar to a bus because a bus wasn't really designed to be convenient. The bus was designed to be less expensive. It's a lot cheaper to take the bus than have an old car. But if you go on this program, you only show one ID card. Just like Joe Namath says on TV and Jimmy Walker says on TV all the time, it's the one card that does it all. It's the Medicare Advantage program. Now, so Medicare Advantage is the name of the program. They have to name everything twice. So it's also called Part C. Now, we tell people the letter C stands for combines. It doesn't really, we just make that up, but it does technically kind of combine everything together underneath one card. But it's a government program administered by insurance companies. So you don't get a Medicare Advantage plan, you get a United Healthcare Medicare Advantage plan, or a Humana Medicare Advantage plan, or an Aetna Medicare Advantage plan. And these Advantage plans combine drug coverage most of the time. They combine drug coverage with it. So you don't have a separate ID card for drug coverage. You still have drug coverage. It's just included inside the Advantage plans. All right. So now we know Medicare Advantage is one giant government program. And here's how it works. So kind of just like a bus, you can't go anywhere that you want to go whenever you want to go. You've got to go where the bus goes. So that's kind of like a network of doctors, right? So Advantage plans are going to have a network of doctors. So if you have any friends that say things like, well, I'm on Medicare, but I have to go to Blue Cross and Blue Shield doctors. Or I'm on Medicare, but I got to go to Humana doctors. It's perfectly fine. They just have a Humana Advantage plan or a Blue Cross and Blue Shield Advantage plan. But the network of doctors, you got to stay in the network of doctors. And just like the bus, every time you use a bus, you have to pay a bus fare, the little fee to ride the bus. Same thing with these Advantage plans. There's a copay for every service. And I would say the copays are very reasonable. I'll give you some overall examples of some copayments. If you go on an Advantage plan, most Advantage plans have a copayment at the specialist around $30. Some are $20, some are $40, but we're used to typically paying copays when we go to the doctors. So copay at the specialist. If you go to, have a surgery, a copay for a surgery is typically around $300, like a cataract surgery. Your copay might be $300. If you go to get an MRI is usually around $200 to $300 as a copayment. If you get an X-ray, there's a copay. If you go to physical therapy 3 times a week for 6 weeks, you're going to have a copay 3 times a week for 6 weeks. That's actually one of the phone calls we get quite a bit. It is, did you know I had to pay a $40 copay for the physical therapist every time I go? Yes, yep, that's how that works. But just like the bus, you go where the bus goes and pay bus fares. And just like before, we still pay copays for prescriptions, and the copays for prescriptions are going to vary depending on the drug tier. So whether you go on a supplement, like we talked about at the beginning, or an Advantage plan, either way you go, you're still going to be paying copays for prescriptions. You also have to pay for Medicare. So whether you go on a supplement plan or an Advantage plan, everybody still has to pay the $174.70 every month for Medicare Part B. All right. Well, if you're a high-income earner and you jump on the bus, IRMA is jumping on the bus with you. So you would still have to pay any income-related adjustments, and you'd still have to pay the base rate for Medicare Part B, even if you go on an Advantage plan. But here's the difference. Remember earlier with the supplement plans, you had to pay around $130 for a supplement and then another $30 or so for a drug plan? An extra $160. Most counties in most states have some Advantage plans as an option that are zero. So I'll use Virginia as an example, because in Virginia, every single county in Virginia does have Advantage plan choices that are $0 a month. So you could get a Humana plan for $0, or a United Healthcare plan for $0, or a Blue Cross and Blue Shield plan for $0. Does that sound kind of weird to anybody else? Like, how can you buy a Blue Cross and Blue Shield plan and not pay Blue Cross anything? Like, how can you buy an AARP United Healthcare plan and not pay United Healthcare any money? Zero. Okay, these plans aren't free, but they're heavily subsidized by the government to the tune, on average, is around $1,200 a month. So let me explain how that works. So the government, Medicare is giving these Advantage plan companies like Humana and Blue Cross and Blue Shield and Aetna. Medicare is giving these insurance companies around $1,200 a month every month if you go on an Advantage plan. And the government's done right then and there. The government does not have to pay 80% of your medical bills anymore. So the government is kind of looking at this like, heck, we don't have to pay 80% of a pacemaker. We don't have to pay 80% of a knee replacement. Instead of paying 80% of people's medical bills, Medicare gives the money to the Advantage plan company that you chose, and that Advantage plan is going to have to pay your medical bills, and you're going to share in those medical bills in the forms of copays. So you pay a little, the insurance Advantage plan would pay the rest. So that's why I say it's also kind of like the bus, if you think about it, because you don't have a monthly bus payment. That's why the monthly Advantage plan for most areas doesn't cost anything per month. So you don't have a monthly bus payment, but every time you use the bus, you got to pay a copay for every service, and you got to stay in the network of doctors. So I'm going to go
We
into
do
one
have a
last.
question.
Oh, we do?
Yep. Someone said, what are the restrictions to change option from number 1 to number 2 and then back to 1?
Whoever asked that is the most perfect timed question.
Okay.
So,
I
good
knew
job.
you covered it.
That is fantastic. So here's how this works: is changing between plans. Okay. So again, this is in most states. This is how this works. It's a little different in New York. It's different in Wisconsin and Minnesota. So there are a few little handfuls of states that are kind of weird. But as a general rule, let's talk about switching between options. That's that main question. Okay. When you are new to Medicare, and you're only new a couple of times in your life. So here's when you're considered new. When you're turning 65, you're considered new to these Medicare plans. If you're over the age of 65, but now you're coming off of a group health insurance, because you'd be surprised, more and more people are working past age 65. They're working till they're 67, 68, some of them 70. Well, when you're coming off of a group health plan, you're also considered new. Now, when you're new, both of these options are on the table. You can choose option 1 or option 2. You can choose the car or the bus. Every single company has to offer you their plans, and they have to let you buy them. So you have to get an Anthem supplement or a United Healthcare supplement. They cannot ask you medical questions. They have to take you when you're new on option 1. Now, in the future, if you don't like your car, if you don't like your Medicare supplement plan, maybe it's just gone up in price, maybe you don't want that much coverage anymore, you can always move from option number 1 and jump on option number 2. So you can go from a supplement over to an Advantage plan, no problem. So you can go from the car to the bus. The bus will always take you. Or you can start on the bus. Like, you can start on Medicare Advantage. So let me get this straight. You can start on Medicare Advantage, or you can get onto Medicare Advantage later. But there's a little bit of it, little misknown thing, that as a general rule, once you get on Advantage plans, you cannot come off Medicare Advantage plans. So that's kind of the rule. So I always tell people, once you get on the bus, you're pretty much going to be locked into the bus. You can change seats on the bus. That is no problem at all. Changing seats on the bus is pretty simple, but you're still on Advantage plans. I'll give you an example. Like if you're on a Humana Advantage plan and you wanted to go to the United Healthcare Advantage plans, well, you just call us and we move you from the Humana Advantage plan to United Healthcare's Advantage plan. But now you got to go to United Healthcare doctors and pay the United Healthcare copays. See what I mean? If you go with a Cigna Advantage plan, you just move from United Healthcare to Cigna and go to Cigna doctors and pay the Cigna copays. You're still on the bus. You just really can't get off the bus. And guys, there are exceptions to the rule, but the rule is once you get on Medicare Advantage, you're pretty much going to be locked into Medicare Advantage. Now, here's the reason why that is. When you're no longer new, remember I said you're new when you're turning 65 or coming off of a group plan. Turning 65, coming off of a group plan, they have to say the supplements regardless of your medical conditions. But later on in life, these supplement companies get to ask you a bunch of nosy medical questions. And if the supplement company does not like your answers, they do not have to sell you the supplement plan. Well, logically, if you think about it, when people are pretty healthy and not going to a lot of doctors, they love their Advantage plan because their Advantage plan is so much cheaper. So, and maybe the Advantage plan is covering the doctors that they currently went to anyways. So it's like, my doctors are in my network. I just have to pay a couple little copays here and there. I'm not paying anything per month. So my Advantage plan is working perfectly fine. But then I get sick or I get injured. And now that I'm sick, I'm starting to go to a bunch of doctors, or I'm starting to have some different procedures, or I'm starting to have a bunch of physical therapy. And all of a sudden, I'm starting to have to pay a bunch of bus fares, a bunch of copays. Or if something comes up and I wanted to go to specialty hospitals like Johns Hopkins or the Mayo Clinic or MD Anderson or something like the Cleveland Clinic or something like that. Well, now all of a sudden, I might not like my Advantage plan because my Advantage plan won't let me go to Johns Hopkins. Well, now I want a car. Now I want a supplement plan. But then it's too late because the supplement companies get to ask medical questions. And the first question they're going to ask is, how tall are you? How much do you weigh? Do you have medical conditions like heart conditions or lung conditions or brain conditions or skin conditions or all these different things? And most people don't want to go to Johns Hopkins because they're healthy. They need to go there and want to go there because they've had some major medical challenge comes up. So then the supplement companies would not take them. They don't have to take a client later in life. So I would say that's probably the biggest misnomer with Medicare is we get thousands of phone calls during the enrollment period from people who said, this Advantage plan has been fantastic. I've loved my Advantage plan. My Advantage plan has saved me a bunch of money. But now I'm sick. Now I'm injured. Now I want to get a supplement. And we have to tell them they can't get a supplement. And they didn't know that. And they always say the same things. They always say, well, that's not fair. And nobody told me. That's a phone call we have many, many times a day. And that's what they always say. Nobody told me I couldn't move to a supplement plan later. Nobody did. So I would say that's one of the biggest misnomers is that right there. And again, there's a few exceptions to the rule, but pretty much the rule is once you get on Advantage, you're going to be pretty much locked into Advantage plans. All right. I'm going to open it up for questions. Hopefully that answered that question.